Hi, welcome in. Go ahead and take a seat wherever you're comfortable. A lot of people really like that couch, but that chair is a favorite too, so just wherever you'd like. Okay, perfect. Very good choice. So, first of all, I'm Dr. Veda. We did speak on the phone, and I'm really excited that you've chosen to pursue therapy with me. I think it's going to be very helpful for you. For the first appointment, usually what I like to do is ask you some questions, kind of get to know you. I usually go through sort of a screening questionnaire to see what might be going on, and then we can think about the best way going forward to help you, okay? All right. So today, if you are uncomfortable answering anything, or if you just don't feel like answering it right now, that is totally fine. I do realize we're just meeting each other, so I don't expect you to totally open up immediately, but it does help me get an idea of sort of what's going on and the best way to help you. It can also help with diagnosis as well, but we won't get into that today. Okay. So I'm just going to be taking some notes here on my iPad. A lot of the questions will be yes or no, but some of them are open-ended as well. So, first of all, do you have a regular primary care doctor? Okay, perfect. So we do have your paperwork up front, and I can just check on there for that. When's the last time you had a physical? Okay. Thank you. And have you been hospitalized within the last year? Okay, good. That's good to hear. And have there been any changes in your health over the last year? Okay. Are you currently taking any medication that is prescribed by a doctor? Yeah, okay. And do you know the dosage on that? Perfect. And how frequently do you take that? Okay. Anything else? Yep. Okay. And the dosage on that as well? Okay. Perfect. And that's daily too? Okay. Fabulous. Anything else? Okay. Yeah. And any vitamins or supplements? Yeah. And that's just like a multivitamin that you take every day? Okay. Yeah. Sorry about some of the loud noises. We do have some construction going on around here, so hopefully it won't bother you too much. Have you ever been told that you have a thyroid problem? Okay. And have you ever been told you have diabetes or hypoglycemia? And do you get short of breath during mild exertion or when you lie down? Okay. Thank you. I'm going to list some medical conditions. Let me know if you have a history of any of them, okay? Stroke, anemia, rheumatic fever, asthma, high or low blood pressure. Okay, yeah, that makes sense with the medication. Any heart pain? Good. Heart murmur, heart attack, heart surgery, tuberculosis, ulcers, cancer. Let's see. Have you ever had fits, seizures, convulsions, or epilepsy? Okay. Do you have any other medical conditions? Okay. Any medication or food allergies? Okay. And what's your usual reaction to that? Yeah. Well, we'll definitely keep you away from that then. All right. So now these are sort of personal questions. They're going to ask about the kind of person you generally are and how you've felt or behaved over the past several years. Some of them are for a specific age range, and I'll make sure to be very clear about that. So we'll answer yes, of course, if the question does apply to you, and no if the question does not apply to you. If you don't understand, I can provide clarification, and right now you don't really have to give me background details. It's just a yes or no unless you want to go into it further, okay? So number 1, have you avoided jobs or tasks that involve having to deal with a lot of people? Okay. Do you avoid making friends with people unless you're certain they will like you? Okay. Do you find it hard to be open even with people you are close to? Do you often worry about being criticized or rejected in social situations? Okay. Are you usually quiet when you meet new people? Do you believe that you are not as good, as smart, or as attractive as most other people? Are you afraid to do new things that might be challenging or to try anything new? Okay. Is it hard for you to make everyday decisions like what to wear or what to order at a restaurant without the advice and reassurance from others? Okay. Do you depend on other people to handle important areas of your life, such as finances, childcare, or living arrangements? Do you have trouble disagreeing with people even when you think they're wrong? Do you find it hard to start projects or do things on your own? Okay. Is it so important to you to be taken care of by others that you are willing to do unpleasant or unreasonable things for them? Okay. Do you usually feel uncomfortable when you are by yourself? When a close relationship ends, do you feel you immediately have to find someone else to take care of you? All right. Do you worry a lot about being left alone to take care of yourself? Are you the kind of person who spends a lot of time focusing on details, order, or organization to make lists and schedules? Okay. Do you have trouble finishing things because you spend so much time trying to get them exactly right? Okay. Are you very devoted to your work or to being productive? Right. Do you have very high standards about what is right and what is wrong? Do you have trouble throwing things out because they might come in handy someday? Is it hard for you to work with other people or ask others to do things if they don't agree to do things exactly the way you want? Okay. Is it hard for you to spend money on yourself? Right. And is it hard for you to spend money on other people? Okay. Once you've made plans, is it hard for you to make changes? Okay. Have other people said that you're stubborn? Do you often get the feeling that people are using you, hurting you, or lying to you? Are you a very private person who rarely confides in other people? Okay. Do you find that it is best not to let other people know much about you because they'll use it against you? Okay. Do you often feel that people are threatening or insulting you by the things they say or do? Are you the kind of person who holds grudges or takes a long time to forgive people who have insulted or slighted you? Okay. Are there a lot of people you can't forgive because they did or said something to you a long time ago? Okay. Do you often get angry or lash out when someone criticizes or insults you in some way? Have you sometimes suspected that your spouse or partner has been unfaithful? Okay. When you're out in public and you see people talking, do you often feel they are talking about you? Okay. When you're around people, do you often get the feeling that you're being watched or stared at? All right. Do you often get the feeling that the words to a song or something in a movie or on TV has a special meaning for you in particular? Are you a superstitious person? Have you ever felt that you can make things happen just by making a wish or thinking about them? Okay. Have you ever had personal experience with the supernatural? Right. Do you believe you have a sixth sense that allows you to know and predict things? Do you often have the feeling that everything is unreal, that you're detached from your body or mind, or that you're an outside observer of your own thoughts or movements? Okay. Do you often see things that other people don't see? Do you often hear a voice softly speaking your name? Yeah, okay. Have you had the sense that some person or force is around you, even though you can't see anyone? Okay. Are there very few people who you're really close to outside of your immediate family? Gotcha. How many close friends would you say you have, just as a follow-up? Gotcha. Okay. Do you often feel nervous when you're around people you don't know very well? Okay. Is it not important to you to have friends or romantic relationships? Okay. Would you almost always rather do things alone than with other people? Okay. Are there really very few things that give you pleasure? Does it not matter what people think of you? Do you rarely have strong feelings like being angry or feeling joyful? Gotcha. Do you like being the center of attention? Okay. Do you tend to flirt a lot? Okay. Do you often find yourself coming on to people? Okay. Do you like to draw attention to yourself by the way you dress or look? Do you tend to be very dramatic in your actions or speech? Do you feel sometimes like you are putting on a show for people? Okay. Are you more emotional than most other people? For example, sobbing when you hear a sad story? Okay. Do you often change your mind about things depending on the people you're with or what you have just read or seen on TV? Do you feel that you're good friends even with people who provide a service, like your plumber, your car mechanic, or your doctor? Okay. Are you more important, more talented, or more successful than most other people? Have people told you that you have too high of an opinion of yourself? Okay. Do you think a lot about power, success, or recognition that you expect to be yours someday? You're doing a really great job. I know it's a lot of questions. We do have about 40 more. Okay, so if you need to take a break at all, just let me know. Do you think a lot about the perfect romance that will be yours someday? Okay. When you have a problem, do you almost always insist on seeing the top person? Okay. Do you try to spend time with people who are important or influential? Is it important to you that people pay attention to you or admire you in some way? Okay. Do you feel that you are the kind of person who deserves special treatment or that other people should automatically do what you want? Okay. Do you often have to put your needs above other people's? Thank you. Have others complained that you take advantage of people? Do you generally feel that other people's needs or feelings are really not your problem? Okay, thank you. Do you often find other people's problems to be boring? Okay. Have other people complained that you don't listen to them or care about their feelings? Thank you. When you see someone who is successful, do you feel that you deserve it more than they do? Do you feel others are often envious of you? Gotcha. Do you find that there are very few people who are worth your time and attention? Have other people complained that you act too high and mighty or arrogant? Have you become frantic when you thought about someone that you really cared about and thought they were going to leave you? Okay. Do relationships with people you really care about have lots of extreme ups and downs? Does your sense of who you are often change dramatically? Okay. Are you different with different people or in different situations so that you sometimes don't know who you really are? Sure, that one's kind of a strange question. Are you different with different people or in different situations so that you sometimes don't know who you really are? Yeah. Okay, yeah. Thank you. Have there been lots of sudden changes in your goals, career plans, religious beliefs, and so on? Okay. Have there been lots of sudden changes in the kinds of friends you have? Okay. Have there been lots of sudden changes in your sexuality? Okay. Have you often done things impulsively? Does your mood often change in a single day based on what's going on in your life? Thank you. Do you often feel empty inside? Do you often have temper outbursts or get so angry that you lose control? All right, thank you. Do you hit people or throw things when you get angry? Okay. Do even little things get you very angry? Okay. When you get very upset, do you get suspicious of other people or feel disconnected from your body? Okay. All right, these next several questions are about before you were age 15, okay? Before you were 15, did you bully, threaten, or scare other kids? Okay. Did you start fights? Okay. Did you hurt or threaten someone with a weapon? Okay. Did you do cruel things to someone that caused them physical pain and suffering? Okay. Did you hurt animals on purpose? Okay. Did you mug, rob, or forcibly take something from someone? Okay. Did you set fires? Did you deliberately destroy things that weren't yours? Did you break into houses or cars? Did you lie or con people to get something you wanted? Did you sometimes shoplift? Okay. Did you ever run away and stay overnight? Okay. And then these two questions are before you were 13 years old. So, did you often stay out very late, long after the time you were supposed to be home? Okay. And did you often skip school? Okay. Thank you very much. So those are all of the sort of screening type questions. Now I'm going to ask you a little bit of background information, okay? So we'll talk a little bit about your current life situation and then your history. So first off, we did talk a little bit about this on the phone, but what are the main problems that are causing you to seek treatment at this time? Okay. Gotcha. How long has that been going on for? Yeah. Anything else? Yeah. And those two things often go hand in hand. Generally, it's sort of the same cause. So when we get to the root of it, should be able to help with everything, okay? Between 1 and 10, 1 being mildly upsetting and 10 being completely incapacitating, how would you rate the severity of your problem? Okay. Yeah, well, you have really done a great thing coming and starting therapy. I think that's going to really help. Let's see. We talked about when your problems began. If you could think of what you think might be a root cause. Okay. Yeah, it sounds like that could be a big part of it. Can you describe to me what you do on a typical work day, starting when you wake up in the morning? Okay. And what time is that? Okay. And so how long is your work day then? Yeah. And then afterwards? Okay. Watch TV. And what about before you go to bed? How do you help yourself wind down at night? Okay. And did this pattern change when your present difficulties began? Yeah, it's kind of a hard question to answer because I know it's been going on for so long now. Okay. Thank you. How about on your days off? What does your day look like then? Okay. Do you usually see friends or family or anything? Okay, yeah, sometimes. And are you happy with this schedule that you've sort of adhered to? Yeah, okay. Well, I think we need to work on eventually incorporating some different activities into your day. Because it looks like you don't get a whole lot of socialization. I think that could be really lonely. Yeah. Is that something that bothers you, or do you like that? Yeah. Sorry about my stomach, by the way. I swear I'm not just sitting here thinking about food. Okay. So these next questions are about your current social life. How well do you get along with people in your family? All right. And how about people you see on a daily basis that you don't necessarily consider close friends, like coworkers, acquaintances? Yeah. Do you think that might be linked to the anxiety at all? Yeah, totally understandable. And how about your current relationships with close friends? How's that going? Okay. So, would you say that your relationship with close friends has changed because of the issues you're experiencing? Yeah, it definitely sounds like it. Just gonna take a few notes on sort of how that relationship has changed. Out. S. Okay. So on a scale of 1 to 10, again, 1 being very difficult and 10 being very easy, how difficult is it for you to make friends? Yeah. Okay. And how difficult is it for you to keep friends? Gotcha. We already talked earlier about how many close friends you have. That down here. How often do you talk to these close friends? Would you say it's on a daily basis? Oh, okay. So do you feel like you're losing touch at all, or is it a relationship where you can go weeks and then just catch up and it'll be like you never missed talking? Yeah. Okay. Okay. And then again, on a scale from 1 to 10, rate the degree to which you generally feel relaxed and comfortable in social situations. 1 being very tense, 10 being very relaxed. Okay. The next couple questions about your current work life. Can you just tell me a little bit about your current attitude toward work? How do you feel about your job? Okay. And do you feel like you're having any problems carrying out your responsibilities at work? Yeah. Gotcha. And is this something that you think other people are noticing, or does this feel just internal for you? Okay. Thank you. Now, about your intimate relationships, how comfortable are you now with the idea of being trusting, open, and close in a loving relationship? 1 would be extremely uncomfortable, 10 would be extremely comfortable. Okay. Do you find it kind of hard to open up to somebody? Do you think that's because of having difficulty trusting, or is it just that you have a hard time connecting? Okay. Understood. Thank you. And are you currently living with anybody? Okay. On a scale of 1 to 10, how critical do you think your partner is of you? 1 being not at all, 10 being very critical. Okay, that's good. So you feel very supported. That's wonderful. Okay. And do you plan on being in your current relationship long term? Yeah. Okay. I know it can be kind of hard to say, but that's good. All right. So now we'll talk a little bit about your childhood. Did you experience any significant moves as a child? Okay. And were you ever separated from one or both parents for a significant period of time throughout your childhood? Okay. How old were you? Yeah. Well, that's a pretty formative age. Do you feel like you have any significant difficulties because of this separation? Is it something that still kind of bothers you at all? Gotcha. So, tell me a little bit about what that was like. Yeah. Did anybody else kind of step in to help? Alright. It sounds like that must have been a really difficult time for you. How would you characterize your father when you were a child? What was his attitude toward you? Yeah. And how much were you able to confide in your father as a child? I see. How did your father discipline you? Was that for just minor things? Or... Yeah. Oh, okay, so you would say he was very strict. Very strict. Gotcha. Thank you. And how about your mother? How was her attitude toward you? Okay. And how much would you say you were able to confide in your mother? Yeah. And how did your mother discipline you? Oh, okay. So would you say your father was more of the disciplinarian then? Yeah. But still a very strict household? Okay. Thank you for clarifying. Now, how did your parents get along? All right. And did you have siblings? Oh, okay. How did the children in your household get along with each other? Oh, that's good. Okay. Are you still close like that? That's wonderful. It's good to have that support network, like I said. How openly were affection and anger expressed in your childhood household? All right. So would you say most of the affection came from your mother? Okay. No, that can happen, definitely. Was religion an important part of your upbringing? Okay. And are you still practicing then? Okay. And did you have any particular fears or phobias as a child? Something you would say is more than just the typical or usual? Okay. Do you still kind of have that issue? Okay, yeah. Anything else? Gotcha. Thank you again. Appreciate you sharing all of this with me. Now we'll talk just a little bit about your friendships, okay? As a child, younger than 13, how difficult was it for you to make friends? 1 being very difficult, 10 being very easy. Okay? And do you think it's more difficult for you to make friends now than it was as a child? Okay. As a child younger than 13, how difficult was it for you to keep friends? Yeah, I can see that. If you're moving around a lot, it's really hard to keep friends, especially as a kid, because you don't really have your own agency to contact people from your past. You don't really have that ability, so it can feel a little disconnected at times with your community. How many close friends did you have as a child? So really just a lot of reliance on your siblings for those relationships. I understand. Okay. And as an adolescent, how difficult was it for you to keep friends? Okay, yeah. So things kind of calmed down a little bit when you were a teenager. You were able to stay in one place for a while. Understood, yeah. Do you still have any of these friends from high school? Yeah, okay. Perfect. All right. So, for right now, I would like you during this week to get in touch with your primary care doctor, okay? Where it's been such a long time since you've had a physical. I do want to make sure that we don't have additional health factors causing your issues. Also, if I do eventually want to prescribe medication for you, if that's a route that we want to go on to help you, we want to make sure that you're otherwise healthy and can take the medications, okay? So your homework this week is to contact your primary care provider and schedule a physical, okay? Yeah, no, I totally understand it can take a while to get in. We just want to try to get you on the books. Is that something that you think you'd be comfortable doing? Perfect. All right. So that's all I want you to focus on this week. Just make that appointment. And next week, this same time, you'll come back and we can really dive into talking about some of these issues a little bit more thoroughly now that I have a broad picture, okay? All right. In the meantime, if you find yourself really struggling, if you need to talk, you can contact me by text or you can call me. If I'm meeting another patient, I'll just get back to you right away afterwards. I'm pretty quick to respond. So for right now, just focusing on getting your health in line, just in case there's underlying factors there, and then if we want to prescribe medication, okay? All right. So I'll see you next week, and we can get it more in depth into some of the nitty-gritty stuff, okay? All right. Thank you so much for your being open, honest. I really think that therapy is going to be very helpful for you. And make sure to reach out to me if you need anything, okay? That's what I'm here for. All right. Well, I'll probably send you a text this week sometime just to see how you're doing, checking in. Otherwise, I will see you next week. All right. Okay. Well, you have a great week.